Hello, my name is Shannon Bohanna, and I'm going to present a case today on a lady that came into the clinic a few days ago. Initials are OE. She's a 68-year-old Caucasian female. She presented to the clinic today for complaints of low back pain, lower extremity edema, and a cough. So she is able to answer her own questions. She is very anxious this visit, so she does require some redirection. She does require some comforting and to keep her focused on her visit and to kind of help her feel more relaxed, and so we can develop a better plan of care for her. Now, she said she was seen 2 days ago in the clinic and for the same complaints, and she feels like that the medication changes that were made are not working. So she was seen 2 days ago for lower extremity edema, low back pain, and at that time she was given Septin 250 milligrams twice daily for 10 days, and she was told to increase her furosemide from 20 milligrams every other day to 20 milligrams daily. And she just feels like it's not working. So she came back to the clinic today. She says her low back pain is worse than she's ever had before, and she does rate that pain at a 7 out of 10. And she does say that when we inquired with her about her fluid intake, she says she only drinks about 1 glass of water per day. So her vital signs this visit are her blood pressure are 154/88, her heart rate is 79, her respiratory rate is 18, her temp is 98.6, and her O2 sat is 94%. She is allergic to Lyrica and Effexor XR. Both say they make her dizzy. So OE's past medical history is pretty extensive. She does have a long history of GERD, mixed hyperlipidemia. She has peripheral vascular disease. She vitamin B deficiency. She does have a history of a DVT to her right iliac vein. So this would be considered an upper extremity thrombosis. And she does have chronic low back pain for a lumbar disc disorder. Her past surgical history is a cholecystectomy in 1994 and a biopsy of her lymph node in 2011. Her family history is her father had CAD and has passed away, and her mother and her uncle have both passed away and had lung cancer. Her social history, OE lives alone. She is not married. She is retired. She worked in a factory job for many years. She is poorly educated and she is illiterate. She is unable to read, but she is able to write her name and small words only. She does live nearby a brother and a sister who do help her manage her medications. Her medication list, due to the changes required for her warfarin, can be confusing considering she is unable to read. Her family does help her manage that, and she does demonstrate compliance with managing her meds and the ability to take those as they are prescribed. She does not smoke. She does have a history of smoking, but she quit about 10 years ago. However, she does still do smokeless tobacco. The pouches, she does about 1 can per week, and she does not drink. It is important to note that OE is a chronic narcotic user. She is on hydrocodone 7.5 that she takes 4 times a day for her back pain. At one point, she was also using fentanyl patches to treat her pain, and she has since been taken off of those. However, she did go through a withdrawal period that did require hospitalization for that. Her current medications, she takes vitamin B12, 2,500 milligrams daily. She is on levothyroxine at 88 mics that she takes on Monday, Wednesday, and Friday, and 75 mics that she takes on Tuesday, Thursday, Saturday, and Sunday. Again, hydrocodone at 7.5 milligrams, 325 milligrams, 4 times a day. Her current warfarin dose is 5 milligrams daily. She is on that trimethoprim, hydrochlorothiazide, 75/50 once a day. The furosemide, as we said, was changed in her clinic visit 2 days prior to 20 milligrams a day. She's on gabapentin 600 milligrams 3 times a day, and rosuvastatin 10 milligrams per day. Her flu shot she received in December of 2023. Her pneumonia she received in April of 2023, and a COVID vaccine she received in April of 2021. Review of symptoms. She is well developed, well nourished. However, she does appear to be disheveled today. Hair is uncombed. Her clothes do appear to be dirty, and she, like I said before, she is very anxious. Does require comforting to be able to assess her, to be able to for her to tell us why she's here today, as she is very upset, again, because she believes that the medication changes that were made 2 days prior to this visit are not working. She denies any skin issues or any kind of like that. She denies any blurred vision. She doesn't sore throat, no mouth or tooth pain, no neck pain or stiffness. She does complain of a cough. She says it is non-productive. She denies chest pain. She does say my feet are swollen. She does not complain of any abdominal pain. She denies nausea, vomiting, diarrhea, or constipation. She also denies dysuria or polyuria, but she does report the low back pain and rates it out of 7 out of 10. Upon her physical examination, she is anxious, adequate historian, does require frequent redirection, no skin lesions or ulceration, mild erythema to her throat, denies ear pain, her tympanic membrane is intact, no bulging or erythema. She does have very poor dentition. She's missing several teeth. Neck is supple, no stiffness, no swelling to her cervical mandibular lymph nodes, no sinus pain on palpation, non-productive cough, no adventitious lung sounds, heart rate is regular. She does have 1+ pedal edema, and varicose veins are noted to her lower extremities. Her abdomen is protuberant but soft. Bowel sounds are active, and she does have the back pain. So the tests we ran this visit, we did do a CMP, a CBC, a rapid BNP, and a UA. Her abnormals for those were her rapid BNP was 140. Her CMP, or abnormals, were sodium of 146, chloride of 111. She did have a GFR of 52. There's something important to note here that her GFR has declined from 77 to 52 since March of 2024. That is something that's currently being monitored. CBC results were normal. Her UA was leukocytes were 1+, ketones were 2+, pH of 6.0. We also did a COVID flu, and she was negative. So the assessment today would be an acute dehydration due to her reports of 1 glass of water per day and her increase in the 20 milligrams of furosemide, acute sinusitis, chronic low back pain, and a UTI. Differentials would be acute kidney infection, rhinovirus, or chronic kidney disease, followed by a mild CHF exacerbation. So we're going to change your antibiotic to Augmentin, 875, 150 BID for 10 days. Strongly encourage her to increase her fluid intake, and then we're going to provide education for self-care to make sure she's following a proper diet and fluid intake, and to encourage her to stop the smokeless tobacco. We'd like for her to follow up in her PCP for a recheck of her urine, her CMP, and her BMP in 2 weeks. Okay, thank you.